Today I'm doing a refinement of a refinement. It's a tricky one. Mandibular midline of 1.5 millimeter, expansion maxed out during the first 2 sets of aligners, and no room for distalization because there is partially erupted wisdom teeth. I'm going to share it with you step by step in real time. If you stick along, it's going to be longer than an hour, but you might catch a few ideas worth stealing. I'm Dr. Petra van der Merwe, an orthodontist with more than 30 years of clinical experience. My orthodontics is focused on aesthetics, driven by everyday function. I help dentists avoid common aligner mistakes and create predictable treatment outcomes. Okay, I've moved the first and the fourth quadrant, improving the overjet overbite, expanding in the bottom, and getting the right inclination of teeth. Teeth aren't upright like that. So I've got gaps in the top. I'll sort that out later. I first need to check and see that's starting to come on. Let me just check. Yeah. What I also did is giving more freedom of movement, anterior guidance, and I need to get these incisors to land on the cingulum there to create a stop contact. So the bite is not deep enough. I need to improve the overbite. In my view, orthodontists tend to end up with a bite that doesn't give the patient enough overjet so that when they go into protrusion, they don't release at the back. There's interferences. So lately I'm tending to really give the patients at least 4 or 5 millimeter. I want to stop contact, the incisors, mandibular incisors touching the cingulum. Looking at this, it's a very typical straight orthodontic smile, no curve. I haven't got the patient's facial photographs on these, so I'm not going to show it now. I'll maybe fit it into the video later, but I need to extrude there. But let me first just finish the bottom arch with which I was busy here. I've moved up to there, so let's get that one. I've got a variation in the talk that doesn't look too bad. Let's get this one straight. It's a very flattened off curve. I can maybe go slightly forward, not too much. Bring this one forward. I used to work with Taman. That was my braces or my system that I used for 20 of my 25 years, 30 years in practice. So I tend to work with a square face, a square type of arch shape. That is my preference. Bring this one forward just to get more of an arch shape here, not that flat. Something looks odd here with the roots. Yeah, there's a bend there, which I don't know. Let's just get this one up, straight up. I'm going to ignore that root. I don't think that is the real morphology. And let's see. I've got some spaces here. I'd rather go with that tooth. There we go. That might cause instability there. It's on the marginal ridge, not totally on it. It's not in the fossa there. So I don't like that. I just don't like that. I want to end up in a stable position with that cusp there. That one actually seems to be very nice. That one seems to be nice. So that must be part of a rotation maybe. Let's see. Yeah, at the moment I don't know how to improve it. This is times where I'll maybe start looking at interproximal stripping to get a better positioning there. I don't like this, I don't like that. You can see that. That is no stable occlusion. There's nothing that's going to make those teeth stay there. So let's just go back there. Teeth slightly going forward. Let's see if I take it back again. Add the top one. Yes, it's going to be actually would love a better relationship there. Okay, I can distalize maybe 1 millimeter. Oh, it's not one, it's like 0.1. Let's see what now if I close this. Keep on running in trouble there. Okay. They told us you can be either on the marginal ridge or you can be in the fossa. So let's just check what I've got here. A huge difference in the height of the marginal ridges. This one is the same height, this one extruded, so let's just get it slightly back and see if I've got a better contact point there, marginal ridge, and let's get the two together again. I'm going to have to go either forward or backward. I can't leave it like that. It's not good. No. This freaks me out. Not freaks me out, but I I know this is not going to be stable. I need to have that cusp to fit into that point there. But let's do the major work, and then I can come back and see if I'll do some interproximal stripping. Yeah, there's also a thing here. I've got some spaces here that if I sort that out, that's going to make a difference. So let us... This one came forward, so let me go back. Get rid of that. Get rid of that. Much less movement there, much better. And let's see what happens now. It's a very high contact there, but okay, let's see. Go forward. That one must come down. There we go. Close up that gap, get a proper contact point there. So I like that. Now we've got a problem here. Let me see. Okay, this tooth is rotated. I haven't got the right. So let's just go to the... There we go. Just not sure about that. Let's see. Judge by the crown contour there and there. This one can't be lying like that. I have to be more evenly. And let's get it from the front. Roll it around, then you can see it's not, that one should be more in. And this one should be more out. And there we've got a more even look. Still, I would maybe do that. Oh, I just love this. This is so perfect. And now I have to sort out this bottom here. Let's see. Remove the roots. That's even. That one needs to be rotated like that. There we go. Put the top one back. And I've moved those two, so I have to change the torque on these as well. Get it slightly out. And I have an even overbite overjet, and I have gaps which I need to close. Let me just quickly see. such a delicate work. And I have to decide about this gap. Again, coming forward or going back. If I come forward, it's going to help me with these spaces. If I move these back, I may end up with a bigger overjet and more space to close. But that canine, let's see, it's not good there. And I've got hard contacts, which is not too hard. I actually have two little contacts here. Immediately it's better. Still not ideal what I would like to have, but I'm going to focus on the front first. I said I need a overjet. I want to give him a smile curve, not a flat surface like here. I've increased the torque, but to extrude here, you're going to have more torque on them. Now, this is not my platform. I can't do you what I want, so I'm going to have to write instructions here. The end game for me is to have an overbite of at least something like that. Let's check it out. I know I'm moving the upper midline now where I wanted to move the bottom one. I'll check that now. Let's just see. Yeah, I have to go back. Maybe a slight overcorrection, which I don't mind because I'm coming that way around. And one thing that I've learned is that what you see on this screen is not happening exactly as you want to have it in the mouth. You always get a little bit less. So I'll overcorrect. I don't mind this overcorrection. Let me put it that way around. I'm going to have to extrude this one as well. I'm going to have to extrude that one to get a slight of a curve.